Assalamu alaikum. Welcome my channel Ali TV. Today topic is depression. Depression is a very important topic. Is a depression. What is depression? Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. Causes of depression. Depression causes feeling of sadness or loss of interest in activities you once enjoyed. It can lead to variety of emotional and physical problems and can decrease your ability to function at work at home. Symptoms of depression. Depression symptoms can vary from mild to severe and can include number 1, feeling sad or having a depressed mood. Number 2, loss of interest or pleasure in activities once enjoyed. Number 3, changes is in appetite, weight loss or gain unrelated to dieting. Number 4, trouble sleeping or sleeping too much. Number 5, loss of energy or increased fatigue. Number 6, increase in purposeless physical activities, inability to sit still, pacing, pacing, hand, hand wringing, or slowed movements or speech. These actions must be severe enough to be observable by others. Next point, feeling worthless or guilty. Next point, difficulty thinking and concentrated or making decision. Next point, thought of death or suicide. It is very important point. Symptoms must last at least 2 weeks and must represent a change in your previous level of functioning for a diagnosis of depression. Also, medical conditions, for example, thyroid problems, a brain tumor, vitamin deficiency, can mimic symptoms, of depression. So it's a very important to rule out general medical causes. Depression affects an estimated 1 in 15 adults, 6.7% in any given year, and 1 in 6 people, 16.6%, and will experience depression at some times in their life. Depression can occur at any point, but on average, first appears during the last teens to mid 22nd. Women are more likely than men to experience depression. Some studies show that one third of women will experience a major depressive episode in their lifetime. There is a high degree of heritability for approximately 40% when first degree relatives, parents, children, siblings, siblings have depression. Depression is different from sadness and grief, the death of loved one, loss loss of job, or ending the ending of a relationship are difficult experiences of a person to endure. It's a normal for feelings of sadness or grief to develop in response to such situations. Those experiencing loss often might describe themselves as being depressed, but being sad is not the same as having depression. The process is natural and unique to each individual and shares some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from unusual usual activities. From usual activities, they are also different in important ways. Number one, in grief, painful feelings come in waves, often intermixed with opposite memories of the decrease. In major depression mode, our interest play are decreased for most of 2 weeks. In number two, in grief, self-esteem is usually maintained. In major depression, feeling of worthlessness and self-loathing are common. Number four, in grief, thoughts of death may surface when thinking of or fantasizing about joining the deceased loved one. In major depression, thoughts are focused on ending one life due to feeling worthless or undeserving of living or being unable to cope with the pain of depression. Grief, depression, and coexist for some people. Death of loved one, losing of a job, being a victim of a physical assault or a major disaster can lead to depression when grief and depression co-occur. The grief is more severe and lasts longer than grief without depression. Distinguishing Distinguishing between grief and depression is important and can assist people in getting the help, support, or treatment they need. How is depression treated? How is depression treated? Depression is among the most treatable of mental disorders. Between 80% and 90% of people with depression eventually respond well to treatment. Almost all patients gain some relief from their symptoms. Before a diagnosis or treatment, a health professional should conduct a thorough diagnostic evaluations including an interview and physical examination. In some cases, a blood test might be done to make sure that depression is not due to the medical condition like a thyroid problems or a vitamin deficiency. Reversing the medical cause would alleviate the depression like symptoms. Evaluation will identify specific symptoms and explore medical and family histories as well as cultural and environmental factors with the goal of arriving at a diagnosis and planning a course of action. Medication, brain chemistry may contribute to an individual depression and may factor into their treatment. For these reasons, antidepressants might be prescribed to help modify one's brain chemistry. These medications are not sedatives, uppers, or tranquilizers. They are not habit forming. Generally, antidepressant medications have no stimulating effects on people not experiencing depression. Antidepressant may produce some improvement within first week or two, or two of use, yet full benefit may not be seen for 2 or 3 months. If a patient feels little or no improvement after several weeks, his or her psychiatrist can alter a dose of the medication or add or substitute another antidepressant. In some situations, other psychotropic medications may be helpful. It's important to let your doctor know if a medication does not work or if you experience side effects. Psychiatrists usually recommend that patients continue to take medication for 6 or more months after symptoms have improved. Longer term maintenance treatment may be suggested to decrease the risk of future episodes for certain people at high risk. Psychotherapy. Psychotherapy or talk therapy is sometimes used alone for treatment of mild depression. For moderate to severe depression, psychotherapy is often used along with antidepressant medication. Cognitive behavioral therapy (CBT) has been found to be effective in treating depression. CBT is a form of therapy focused on the problem solving in the present. CBT helps a person to recognize distorted negative thinking with the goal of changing thought and behavior to respond to challenges in more positive manners. Psychotherapy may involve only the individual, but it can include other. For example, family or couple therapy can help address issues within the close relationship. Group therapy bring people with similar illness together in a supportive environment and can assist the participant to learn how others cope in similar situations. Depending on the severity of the depression, treatment can take a few weeks or much longer. In many cases, significant improvement can be made in 10 to 15 sessions. Lactoconvulsion, convulsive, lactoconvulsive therapy (ECT). ECT is a medical treatment that has been most commonly reversed for patients with severe major depression who have not responded to other treatment. It involves a brief electrical stimulation of the brain while the patient is under anesthesia. A patient type can receive ECT 2 to 3 times a week for a total of 6 to 12 treatments. It is usually managed by a team of trained medical professionals, including psychiatrists, and anesthesiologist and nurse physician or physician assistant. ECT have been used since the 1940s, and many years of research have led to major improvement and the recognition of effectiveness as a mainstream rather than law. Please this video, share, comment, like and subscribe and click the bell icon button. Thank you.